Good afternoon, everyone. My name is Dr. John Paul Sanchez. I have the honor and privilege of serving as the Associate Dean for Diversity and Inclusion, as well as an Associate Professor in Emergency Medicine here at Rutgers, New Jersey Medical School. Welcome to our celebration recognizing Asian American and Pacific Islander Heritage Month, which occurs May of every year. I'm excited that we're here together, not only in celebrating Asian American and Pacific Islander identity, but this is the sixth Heritage Month that we have been celebrating over the past 2018-2019 academic year. So I want to thank you for all your contributions in bringing us to this point. I just want to give you a little bit of historical perspective as how this Heritage Month has come to be recognized as a federal Heritage Month. The call for Asian American and Pacific Islander Heritage Month commenced in June 1977, leading to the first 10 days of May being proclaimed as Asian Pacific Heritage Week. And in 1990, President George Bush signed a bill extending it to a month. The month of May was chosen to commemorate the immigration of the first Japanese to the U.S. on May 7, 1843, and to mark the anniversary of the completion of the Transcontinental Railroad on May 10, 1869. The month of May is now recognized to celebrate the culture, traditions, and history of Asian Americans and Pacific Islanders in the U.S. And as we are aware, there is great diversity within the Asian community, represented by numerous countries, whether it's in West Asia, North Asia, Southeast Asia, South Asia, and so forth. As an academic health center, we must be aware and responsible for the unique health issues and health disparities that are associated with any community. And I just wanted to share this slide that was put together in the discussion of the Affordable Care Act, because I think it does a nice job of depicting some of the unique health issues and health disparities that face the Asian American and Pacific Islander community, where you can see that certain subsects within the PI community have lower rates of health insurance coverage. Here, the community with the lowest rates are Korean Americans, as well as we must be proactive in ensuring that subsects within the community also have strong prevention around mammograms, pap smears, as well as HIV testing, as described here. And lastly, it's important to recognize that within the AAPI community, there's a need for concordant providers, where 1 in 3 AAPI patients speak more than one language. So having a diverse clinical workforce that speaks languages beyond English is much needed for this community. Within Rutgers, New Jersey Medical School, we make a concerted effort to ensure that through the leadership of the Executive Vice Dean, Dr. Maria Soter-Green, as well as the Dean, Dean Johnson, that there's good representation of and inclusion of Asian Americans and Pacific Islanders in working with each of the offices, whether it's within the Office of Medical Education in bringing forth content related to the social determinants of health that face the AAPI community, whether it's involvement in the Office of Admissions as interviewers or on the admissions committee, whether it's in the Office of Student Affairs as a part of careers in medicine or other student advisors for the students, or within the Office of Diversity and Community Engagement through various activities such as this one. I just want to take a moment and highlight some of the other faculty that we've started to feature within our resident and faculty recruitment portfolios in working with the chairs of our 19 basic and clinical science departments here at NJMS. We've had the opportunity to highlight some of our Asian identified faculty, residents, and fellows, and really have them talk about the great work that they're leading at the institution, but also what's brought them to work at Rutgers NJMS. And here are some of those faculty, residents, and fellows. So lastly, if you have any questions or if you want to get a better idea of what we're doing during the month or during the year, feel free to reach out to the Office of Diversity and Community Engagement. Now, I would like to turn it over to our distinguished speakers for this first event entitled Asian American and Pacific Islander Excellence at New Jersey Medical School and University Hospital. Thank you.